Fever, coughing, difficulty breathing. Most of us know those are the possible symptoms of the coronavirus.
Yep, and doctors say they are seeing more cases of a different form of COVID showing up in toes, causing pain. News 5's Bob Jones shows us many patients are kids.
The pictures of COVID toes just look painful, swollen and sometimes turning red, blue, or purple. The condition similar to chilblains normally seen in the colder months.
It can be very painful. I mean, it can be very painful to the point that some people don't want to walk.
In recent months, doctors at Akron Children's Hospital have treated about 20 kids or young adults with suspected cases of COVID toes. That includes 14-year-old GWEN King from Kent. Her toes started feeling strange in March, around the time the pandemic hit Ohio.
And they were very hot and swollen, and I couldn't really feel them, but at the same time they stung.
Back then, access to COVID-19 testing was difficult. GWEN didn't have any other symptoms. The family suspects it was a case of COVID toes, but doesn't know for sure.
It was front of mind a little bit, but I don't know. There was so much conflicting information in the news as to the symptoms. The symptoms kept changing.
Dr. Stephen Spalding, a rheumatologist at Akron Children, says recent research from the British Journal of Dermatology shows the presence of the coronavirus in fingers and toes. Interestingly, Spalding says many patients test negative with nasal swabs, but still have a different form of COVID-19. The jury is still out on how contagious that form is.
If we see it in the toes, but we don't see it in the nose, we're not quite sure whether we can say a person is not contagious or they are contagious.
Dr. Spalding says as the pandemic continues, it's becoming more clear that the coronavirus can be more than a respiratory illness. It can also potentially have a serious impact on blood vessels. GWEN says her experience was scary, but months later, her toes are doing better.
And every once in a while, they'll get a little swollen again, but that's about it.
Dr. Spalding says if parents suspect their kids have COVID toes, they should contact their primary care physician to check for other coronavirus symptoms.
We may actually see more of this as the weather cools off and as kids are in school.
In Akron, Bob Jones, News 5.